mammogram found my cancer, but early, before it had the chance to spread. And because of that, I had a fighting chance. It wasn't an easy journey, but I am standing here today because I caught it in time. If you haven't scheduled your mammogram, do it today. If you have, remind the women you love to do the same. Early detection saves lives. It saved mine, and it could save yours.
Public health officials tout the early detection of cancer as key to improving the chances of successful survival and treatment. On Friday, the Health Ministry donated a mammography machine to St. Jude Hospital.
While the health system strengthening project is on its last quarter, pending its ultimate closure within the next 4 to 6 months, we are assured that the impact of this machine will be experienced over a much longer period by the clients who will be accessing breast cancer screening services at the St. Jude Hospital. This is indeed a fitting gift to the hospital directly, but indirectly to all women and their families in celebration of International Women's Day, particularly the women of the South.
Data from the National Epidemiology Unit indicated that among men, prostate cancer, and among women, breast cancer were the leading causes of death in 2020.
On average, 67 breast cancer diagnoses every year, 23 deaths every year. Again, about 30%. However, if you look at the global rate, lifetime prevalence rate of breast cancer, in the world, it's 1 in 20 women will get breast cancer in their lifetime. In the developed world, it's 1 in 10. And even in the UK right now, they're saying 1 in 8. Well, I can tell you at 67 cases per annum in St. Lucia, and when we extrapolate that, we are actually in the 1 in 10. We have the rates of the developed women in terms of breast cancer. In other words, it is a big problem. Today is a day of hope. Today is a day in the South when our women can say they are in a safer place once they exercise their right to get these screening services.
St. Jude officials are optimistic that the vital piece of equipment will improve comfort levels during the screening process for patients.
This machine is more than just a piece of equipment. It is a symbol of hope, it is a symbol of progress, and it is a symbol of the power of collaboration. With this cutting-edge technology, we are now better equipped at St. Jude Hospital to enhance the services that we provide to our clients, ensuring timely, accurate, and compassionate care as we continue to drive excellent patient care in what is an unusual environment. This machine will not only improve diagnostic accuracy, but also enhance patient comfort, making the screening process as seamless and stress-free as possible.
The permanent secretary in the Health Ministry is elated that the intervention will increase the chances of survival for residents. The ministry plans to donate similar diagnostic equipment to other health facilities in the future.
I feel very happy, just as Minister does, and very proud that we have got to this point as a ministry where we can donate the equipment through the project implementation unit. We can donate this equipment to St. Jude Hospital. We will be undertaking a similar donation with the Millennium Heights Medical Complex. And, it really is a great moment for all women in the south of the island, all ladies, because we now have access to this type of intervention that can really help to save lives. The Ministry of Health, Wellness and Elderly Affairs is in the business of prevention and, and conducting interventions that can both prevent and save lives, prevent illnesses, reduce the disease burden, and to save lives.
Health Minister Moses Jabatis welcomed the machine as a way to empower women to take charge of their health.
We are trying to build networks, as Dr. King said, We are trying to strengthen partnerships, strengthen relationships among the public and private sector. We are trying to ensure that the very simple objective and simple notion of increasing the quality of healthcare in St. Lucia receives energy, receives the kind of encouragement which must come from the policymakers. I wish to thank the staff of the St. Jude Hospital. Dr. King said it himself, that you have really been through trials unheard of, and you continue to steer the ship, and very soon there'll be deliverance. I want to tell you that we are very serious as a government about taking steps to ensure that we increase access to quality healthcare in St. Lucia.
Cancer continues to be a major public health challenge in St. Lucia, with 1,519 cases of cancer recorded between 2018 and 2024. Data from the Health Ministry indicated that despite this trend, there has been a significant reduction in cancer-related deaths, dropping from 330 in 2023 to 168 in 2024, highlighting the impact of early detection and improved healthcare services. Gina Filippi, HDS News Force.